Hi, everyone. So I'm Justin Chan from the University of Washington, and today I'll be presenting an accurate and accessible way to detect middle ear fluid just using the microphones and speakers on your smartphone. So ear infections are the leading cause for pediatric healthcare visits today. And ear infections are typically caused due to a buildup of fluid in a space called the middle ear, which is behind the eardrum. If you suspect that your kid has an ear infection, you would get him to see your primary care provider. And your primary care provider would look in your kid's ear using an otoscope and visually try to diagnose whether there's fluid. But because the fluid is actually behind the eardrum, it's actually really difficult to see, and the accuracies tend to be as low as 51%. Although more accurate tools exist, like pneumatic otoscopy and tympanometry, they tend to require referral to a specialist and can really be pretty time-consuming. So unfortunately, today there really aren't any tools in the market that can accurately and accessibly detect middle ear fluid. As a result, the American Academy of Otolaryngology has called for research into a brief, reliable, and objective method for detecting middle ear fluid. We present the first tool for detecting middle ear fluid using just the sensors from your smartphone. And I'm very excited about this work because it was published only just yesterday in Science Translational Medicine. We conducted a clinical study on 98 patient ears and found we could get accuracies comparable to specialist tools. And we also ran a user study on parents, showing that parents could get the same accuracies as trained clinicians. So how does this actually work? We send a soft acoustic chirp that's 1.8 to 4.4 kilohertz into the ear canal. This is sent through a paper funnel, and the paper funnel guides the waves in and out of the ear canal and prevents the waves from dispersing around the room. The eardrum is then going to vibrate, and the reflected sound waves are going to interfere destructively with the incident waves, creating a dip in sound pressure across a range of frequencies. In an ear that does not have fluid, the ear is actually going to absorb most of the sound frequencies, resulting in a dip that is broad and shallow. But in an ear that does have fluid, the fluid is going to restrict the vibrational capacity of the ear, resulting in significantly more sound energy being reflected back along the ear canal. Due to the increased destructive interference, the dip is going to be much narrower and much deeper. And then now we can just pass these curves into a simple logistic regression classifier and determine if your kid has fluid. So let me now show you a quick little demo of what we have. So this is our smartphone right here, and this is our paper funnel or paper cone that's around the smartphone speaker and microphone. All I have to do is hit the test button and place it in my ear. And just like that, we can see that the acoustic dip is broad and shallow, which is good news for me because, thank goodness, that means I don't have an ear infection. So the question, of course, to ask is, how do we actually determine if there's fluid in the ear? Because it's so hard to see behind the eardrum. The way to do this is we actually have to make an incision into the eardrum. And you can actually see the fluid coming out. And this is a pretty routine procedure that's done for kids that are getting ear tubes. All right? And we conducted our clinical study on 98 patient ears. We did this in the pre-op area with parents and their kids just before they were scheduled for surgery. And our patients were 18 months to 17 years of age, and we collected our data on an iPhone 5S. We got a sensitivity of 85% and a specificity of 82%, which is comparable to the specialist tools like pneumatic otoscopy and tympanometry. The next question to ask is, will this data collected on the iPhone 5S actually generalize to other phones which we haven't trained our model on? The answer is actually yes. And we could build a model just on data collected on one phone and get it to work on the iPhone 6s, the Samsung Galaxy S7, and the Google Pixel. And the great thing about this means that if we want to support a new phone, we don't have to run an entirely new clinical study. Finally, we ran a user study where we got parents. We asked them to take a couple of minutes just to learn how to use our app in the pre-op area and test it on their own kid. We then had a trained doctor test the app on the same ear and found that in 24 of 25 of the ears, the results agreed with each other. So I'm going to close now with a fun little video showing how you might test this on your own kid. All right, so this is really exciting technology, and we're actually in the process of getting this cleared by the FDA soon. And we've also started a healthcare company called Edis Health, and our mission is to try to get this technology into as many hands as possible. All right, thank you for your time, and I welcome any questions. Yeah.
So is there any specific reason why you used iPhone 5s apart from availability?
There is no specific reason that we use that. The important thing, though, is that the microphone and the speaker have to be on the bottom of the phone. But in fact, all modern smartphones have that configuration for noise cancellation. In fact, if you go for the very first iPhone to the current iPhone right now, their configuration is the same. So this will really work across a wide variety of smartphones.
Okay. Time for another question.
Yeah. Or here, yeah.
In your study with the 98 patients, what proportion of them had the middle ear fluid?
Yeah, so half of them were all controls, so patients that really had no ear symptoms at all, and half of them had that incision. And half of those that had the incision had fluid, and half of those did not.
Okay, one last question, Ken. So when kids go to hospital, they are inspecting for ear infection, right? Not middle ear fluid.
So we're detecting middle ear fluid. It's actually fluid that we're detecting for, but a large proportion of people that have middle ear fluid, a lot of the times it actually gets infected. So this is actually useful, I think, especially for parents, right? Who, when they test it in their own home, they don't know if their kid has fluid or not, but if we can tell them, hey, your kid doesn't have fluid, it's kind of like a thermometer. It can prevent them from taking unnecessary trips to the doctor, and we think it's very useful for that purpose.
It's screening before the ear infection.
Yeah, it's screening before the ear infection, and it can be used, by parents or doctors in the developing countries, and those are kind of the use cases that we're looking at right now.